And would you like something under your head, or do you feel?
Yeah, a little bit, yeah.
A little bit. Okay, let's see if this is enough.
Okay.
Not too much?
It's okay.
Okay, great. So first I'll ask you to rest your hands on your belly and begin simply to make your breath longer and slower. Not necessarily bigger. Yes.
Should the hands be like this, or?
Doesn't matter. Rest, whatever feels most convenient. What I want you to feel is the belly rising and expanding when you breathe in, and hollowing a bit inwards when you breathe out. What I'm looking at is the degree to which your breath is diaphragmatic or thoracic, and that's actually really good. You've got a good diaphragmatic breath. I see good movement in the belly. Okay? What I'd like you to do now, again, is make the breath even longer. Every inhalation a little slower, every exhalation a little longer. At the end of the exhalation, gently draw the belly in a bit more if there's room. Release that and inhale, inflate the belly. And continuing to breathe in this way that seeks to be longer and slower, shift your hands to these bones at the sides of your hips. And you're going to move them.
The horns or below?
The horns.
Or the horns?
Exactly, the horns. You're going to move them forward and back. Okay?
Like this?
That's right. And you're going to move your whole pelvis with them. So on the inhale, you arch your back and they move towards your heels. Think about, yep, exactly like that. Move them towards your heels, fill your belly with air. And on the exhale, flatten your back. Those bones will move towards your armpits. Beautiful posterior range. Let's go back and forth a few times. Inhale, anterior. Exhale, posterior. That should feel quite pleasant. This and the next movement are the first thing I do every morning when I wake up.
Now, is the pelvis just go up a little, or you keep it on the ground?
You keep your lower back on the ground, but yes, the pelvis will curl under a bit, that's fine. I'm more interested in your anterior range because I feel like it's a little less available than the posterior range here.
Anterior is this side?
That's right.
Okay.
And that makes sense because of the way you stand. Right? Your hips are forward of your ankles, but you're also a bit tucked. That's why the lower back is flat.
So the range you're talking about is this one?
That's right. We want to increase this range. And the best way to increase this range that I've found is to move the pelvis in circles. That's right.
12, 3, 6, 9?
That's
or
right.
Because in Feldenkrais is also 12, 3, 6. You can do half circles.
That's right. So I'd like you to do full circles and do them slowly. Okay? And what I want you to imagine is that there's a block of ice between your buttocks and your heels. And with every time you're coming forward, it's like you're trying to use the blades of your sit bones to shave a little bit more of that block. That's right. Okay. Good. So the posterior range here, not as important. This is the part of the movement that I'm interested in. Yes. And please keep your inner feet on the ground. In other words, when the knees move from side to side, that's good, but we want to keep the feet on the ground to encourage the rotation to happen actually in the femur heads, coxofemoral joint. Beautiful. You feel how that takes a little bit more mobility from the pelvis, requires a bit more mobility if we keep the inner feet on the ground. Good. And let's reverse directions. Let's go 3, 12, 9, 6. And make even the places between 3 and 12 and 12 and 9 and so on, make them circular and soft and round. Do you feel like there's any part of the movement that's not as available as any other part?
Mm-hmm.
Yes, and which would that be?
Well, the left side, let's see, at 9 o'clock is a bit of sometimes click or pain. And the right side is stiffer.
Yes.
I think.
It makes a lot of sense.
It's hard to describe.
Right. What you're describing makes a lot of sense because, as we saw, in addition to the pelvis being forward and tucked under, it's a bit turned to the right. That means the muscles on the right side will be what I call stuck short, which is stiff, and then the muscles on the left will be stuck long, right? Overstretched, under firing, neurologically speaking. Okay? We're going to keep coming back to this movement. We're going to explore ways to turn on those muscles and calm down the ones on the other side. So David, take your arms out to the sides like this, at about, yeah, you can move that. Good. And a bit lower actually, so chest, no, your body is fine, I just mean instead of up here,
I got you. Okay.
that you're right at about chest height. That's going to be better for your neck.
Okay.
Good. You can take the arms a little bit wider actually. That's good. Legs together all the way. Sure. Soft inhale into your belly. On the exhale, let both knees lower to the right. Keep the knees together, so the left foot's going to come off the ground first. Now pause before the left shoulder blade comes off the ground.
Did it come off now?
It started to want to, okay?
Okay.
So what I want you to do now is with your next exhale, pull your belly in a bit more, and just like that 6 o'clock tilt, you kind of tuck under and see if that gives you more room to lower the knees without lifting the shoulder. Good. There is a tissue continuity, a myofascial continuity, actually from the base of the first metatarsal, the base of the big toe. But for our purposes, from the outer knee to the opposite, or the same side in this case, shoulder blade. And so what we're trying to do is find out how much length can we get between these 2 points, and where do you feel the stretch, if anywhere.
If I had the arm this way, it would be a diagonal.
That's right, and I don't want that, because I don't want to involve the shoulder more than necessary. What I want to know is, are you feeling a stretch along the upper back, middle back, lower back, buttocks?
I'm feeling, it's a pain when I feel strong. If you go along my back, I think you'll feel, I can tell you, but
Yeah.
again, I said I'll get there. And it might be more towards the hip or on the side.
Okay.
Yeah, maybe a little higher, around that area.
Quadratus lumborum. Okay, and with an exhale, pull your belly and come back to center. Would you describe that as a pain?
Coming back?
No, that feeling when you were in the stretch.
A bit of a pain.
A bit of
not an extreme pain.
like a stretch pain.
Okay.
Okay, let's try the other direction, compare the sides.
So when I exhale, I do it?
That's right. It's better because it allows you to pull your belly in more, control
I feel it pulling more in the upper, by the ribs. And it was at the beginning, less now.
Okay, so at the initiation of rotation, we've got some grasping probably at serratus anterior.
Not exactly there.
Right side. Yeah. Seems range of motion is easier on this side though.
You see more range. I
More
feel it.
rotation, yep. Okay. Still very consistent with what we're seeing. Do one more in each direction.
Does it matter if I pull up more or less? Or
It doesn't matter so much. Ideally the feet are
remind me
comfortably.
how to breathe when I go over?
Just exhale and pull your belly in. Yes, exactly. That posterior tilt is going to give you more space for the
Until the shoulder goes up.
before the shoulder goes up.
Okay.
Yeah,
And then again exhale?
that's right. I prefer always to move, especially the lower body, on exhalation, because that way we get better control from the core and pelvic floor.
Here I felt the shoulder went up, but I was able to get it down again.
To choose to put it down. Got it. Yep, and we do have more range. All right, come on back to center, and cross your left ankle in front of your right knee like so. A little flexion in the ankle is good here. And now begin to laterally rotate so before you pick it up actually, I want you to put the weight evenly on both hips. So right now it's more on the left hip. Yes. And begin to laterally rotate this thigh. So that means you actually twist the thigh out. Now right now, this shortened. Could you feel that?
Mm-hmm.
So what I want you to do is try to keep your right waist long as you turn the thigh out. So that means yes. When the right waist shortens for the knee to move away from the face, what we're actually getting is side flexion in the lumbar. And that's not what we're so much interested in. We're interested in a very small range of motion, which is lateral rotation in the coxofemoral. In other words, the actual hip joint turning out, or the thigh
without moving here?
Ideally, as best you can. Yes. Your understanding is fantastic. Your range of motion here is quite limited. Not surprising. It's what I would expect to see from what we saw standing. Try the other leg, please. Keeping the left waist long. keeping the weight.
What does it mean by long here?
I
Pushing
mean,
it down,
so
up?
this would be not long. This would be hiking it up.
Got it.
And exactly. Okay?
Okay.
So that would be a side flexion. And then rotate the right thigh out. Do you feel how much more control you have there?
Yeah.
Even visually, you're probably seeing this, Hannah. It's going much farther.
Many more degrees.
Exactly.
Okay.
Exactly. Okay? So, let's do this. Go ahead and release. We've confirmed in many ways we need to strengthen left lateral rotators. Okay? So I'll show you the exercise, and then I'll guide you through it. I can show it to you on my body first. You can just sit up to watch. You're going to lie on your right side in order to access the left lateral rotators. And this will be... Are you filming right now?
Yep.
Okay, so I can... When you lie on your right side, starting position is going to be here. In other words, you can pull your left knee up towards your face as much as possible so that the angle between the thigh and the belly is sharper than 90 degrees. We don't want to be here, that'll be a lot of hamstring involvement. We want to be here. Okay? And starting position is also with the knee much farther from the floor than the ankle is, so that we're in lateral rotation. We're going to move the whole leg up and down in a vertical range, and what will very likely want to happen is this.
That's not good.
That's medial rotators turning in. So we want to keep the foot close to the floor and lift the whole leg, but the whole time, the distance between the knee and the floor is much greater than the distance between the ankle.
We did that on Friday. I tried it home. It doesn't challenge me much. Is it possible to do it with weights here?
I don't think that will be necessary.
Okay.
We will refine it for you until it
It's
does.
difficult. Okay.
And if not, we'll check. Okay? So come on to your right side. Okay. Good.
Start here.
Yes. And take the foot farther towards the edge of your mat so that the knee can come up higher.
Can you bend this leg?
You can. If it helps you with stability, you can. Now, bring the big toe all the way down to the ground and lift the knee higher up from the ground.
Is the foot flexed or doesn't matter?
It doesn't quite particularly matter, but bring your knee up. Now bring your foot down. Bring your foot down. Bring the knee up. And take the whole leg up and down in that angle. Yes, that's right. The other thing is that